to the Care Right podcast, your go-to resource for all things elder care. Guiding us through this journey is Annalee Kruger, the founder of Care Right Incorporated, and she has been steadfastly supporting families across the United States. Each episode brings you expert insights, innovative strategies, and practical advice, ensuring that you're well equipped to provide the best possible care for your loved ones. Expect to gain valuable knowledge, learn from real-life stories, and get inspired to take action in your own caregiving journey. So buckle up as we dive into an in-depth discussion of elder care planning and together embrace the journey of caring for aging loved ones on the Care Right podcast.
Hi, I'm Annalee Kruger with Care Right Incorporated. Thank you for joining our podcast today for the caregiver crisis. Care Right helps overwhelmed and burned out family caregivers achieve peace of mind, get their lives back on track, their health back on track, their relationships and their careers all back on track by developing a customized aging plan. The families that come to Care Right are in crisis. No one ever calls me because things are going well with having aging parents. Caregivers are burned out, they're missing work, they're taking hours out of their day to coordinate care, manage crises, manage urinary tract infections, dementia progression, hospitalizations, and falls. And so families are really burned out, they're overwhelmed, they're frustrated, and unfortunately, by the time they come to me, they're really in a bad way and things are a mess. Their parents are medically complex or really dementia progressed, and their family relationships are very, very dicey. So I facilitate 5 to 8 family meetings with families. A Care Right aging plan has about 20 bullet points, so to speak, or 20 components to an aging plan. And the reason I have to break those 20 topics down into 5 to 8 meetings is because that's a lot of information to absorb at once when you already have a pretty low emotional bandwidth because you're so burned out and exhausted. So families come to me. I serve families all across the United States. I've been virtual and nationwide since shortly after I started my business in 2011. Because families don't live near each other. The profile of families has changed in the 30 years that I've been a social worker. 30 years ago, I could easily go to Ethel and Marvin's house and the kids could easily gather around the kitchen table and we could have these family discussions and talk about what is your plan, what's working well right now, what's not working well, what are your goals as you age. If your goal is to age in place and stay at home, that's great. But here are the things that you need to know about that. And here's what the cost is going to look like. What's the plan if staying at home is no longer safe, affordable, or feasible? So my team and I also do 30 to 40 family matrix projects per week. So what I mean by that is, say mom and dad live in Tucson, Arizona, and their 4 kids live in 4 different states. It's just not feasible or sustainable to expect kids to just be jumping on airplanes every time there's a fall or a hospital stay. Employers aren't as family conscientious as they used to be 30 years ago, right? So if you're not hitting your sales targets or your numbers, and if your team always has to pick up the slack because you're always having to fly back and forth because of a medical crisis, eventually your career is going to be in jeopardy. So when we talk about a family matrix, we do all of the market research for facilities like healthcare centers and home care centers and adult daycare programs in your particular area. And we put them on a matrix or a spreadsheet. So all of this information is at a glance. And then each organization that's on the spreadsheet also has a corresponding folder within Dropbox, right? We use Dropbox right now that has even more information. So if you want to look at floor plans, amenities, fees, maps of where these care communities or home care companies are, we do all of that. And then we also teach our families how to tour these care communities and how to interview home care companies with confidence so that you don't just fall for anything that they just say, because again, their job is to sell that bed or sell that apartment, right? And so this way you can be an informed consumer and know what questions to ask and what to look for. So we have a 7-page checklist that we include in our aging plan. and what to look for and what to ask about, so that we educate you as a consumer on how to make informed decisions for your family or your loved one. We also include, right now it's a 6-page, but it's always growing because of the care in these facilities and the care within home care. So we include a 6-page how to be a bold advocate, things that you have to check on and inquire about that you wouldn't think that you would have to, but you do. The World Health Organization in 2020 did a study and found that 64% of nursing home workers admitted to abusing or neglecting their residents. So our patient advocacy is so critical that if you have an aging loved one or you're the aging senior and you're finding yourselves in healthcare setting of any type, you have to be a bold advocate to get the best care possible. We also teach families about the differences and levels of care, like what's independent living, what's assisted living, what's nursing home, what's hospice, what's palliative care. So it's all about teaching all of you as family members to be able to make informed decisions, but opening up the doors of conversations of topics that families simply are not having on their own because they don't know what they don't know. And also a lot of times family dynamics get in the way. You know, if you didn't get along with your brother for the last 30 years, you're not going to magically start getting along now that dad's had a stroke and mom's dementia progressed, right? Mm-hmm. So that's what we do. We facilitate family meetings, help everybody get so that you can make informed decisions. We also have a checklist that we go through to make sure that the whole family, because our client is the whole family. So we also help make sure that if you have your estate documents in order, are they signed? Are they updated? Are the people that you named 20 years ago as your healthcare agent still someone that's alive, that's not demented, or that you still trust to make decisions on your behalf? We talk to families about getting all of your affairs in order, your accounts, your passwords, your funeral home planning. If you're a veteran, you know, getting all your paperwork in order. You've got the grab and go binder that, if you know me, I always harp on this too, because the last thing you want when there's a medical crisis, because there is going to be medical crisis. None of us, whether you're the parent or the adult kids, get through this aging journey without being unscathed, right? There's going to be falls, there's going to be disease progression, there's going to be unexpected passing away. So it just is common sense to have all of your documents in order, make sure they're updated so that when that crisis happens and the doctor says, we need a copy of the healthcare power of attorney, this, boom, it's right here. You know, or if you're the financial power of attorney and your dad had a major stroke and he's incapacitated, you're not spending hours going through desk drawers and trying to figure out where are they, what accounts do they have, what passwords, do they have long-term care insurance? So it's really just getting families buttoned up. Part of our aging planning is we use a collaborative approach. I'm sick and tired of industries that work in silos. Healthcare is one of those industries that work in silos. Nobody knows what the other organizations are doing. And I hate that, because that's why families are falling through the cracks. That's one of the reasons I started my company in 2011. And it certainly hasn't gotten any better since then, especially with a pandemic. So using a collaborative approach, because certainly I don't have all the answers. That's why I partner and team up with people who do, right? So I'm kind of the hub. And then it's like, oh, you need to learn more about Social Security, or you need to learn more about Medicare and how that all works, or you need to learn about long-term care insurance. So I have people in all of those different categories that my clients need. So today I'm excited to introduce Marcia Mantell, and she is going to talk to us today about Medicare and Social Security. Marcia, take it from here. Tell us about you and kind of what you do.
Oh, Annalee, thank you so much for inviting me back to the podcast. And wow is all I have to say. You know, there's so much for families to think about. And I think the approach you're taking is absolutely marvelous. So now I sort of picture, you know, my family or any family, you know, you're right. Adult children who didn't always get along, parents who are separated or divorced. And there's all this complexity to the family, right, that you're trying to deal with now as the aging process marches on. But for you meaning the adult child, you also have to be planning for your own retirement. So where I come into the picture and have been in the retirement industry for the last 30 years, I work with financial advisors, I work with consumers, individuals, to help them prepare for their own journey into the aging process. And it's not only the financial side. I look at retirement as time on the one hand and money on the other. We never have enough of either. So how do you maximize both your time and your money? And if you're dealing with a family in crisis, your time is zapped. You're so right, Annalee, in that if you're still working, which most of us adult children are, this is a problem for your business and for your employer.
Mm-hmm.
So you're lacking time, and now your resources get to be zapped. What that results in is misunderstanding or making not ideal decisions about Social Security and Medicare, which are the underpinnings to all of our retirement. It's the way our system works here in the US. So if you don't get those right, you have long-term problems. You have different long-term problems in addition to the aging. And we want to help you avoid making some of those big missteps, mistakes, or the misunderstandings that are floating around out there.
I think one thing to chime in about too, and I mean, I hope everyone that's watching or listening understands like how informative this podcast is going to be, because Marcia is like the expert in Medicare and Social Security. That's why I keep having you back on, because families need to know they're making horrible, costly mistakes, and you can't undo those, right? Like
No,
you have one shot to get this right. And so you have one shot to make smart decisions. And that's why I keep having you on, because you can educate consumers and you work with consumers directly as well. And you have people on your team that can work with consumers directly as well. Because, we talk about those of us that are working or running our businesses, and then dad has a stroke and now life as we knew it is upside down. And that's happened to many of us, right? Because we're all in that age group where things are just going to start happening with our parents, and we can't be in denial about it. But what about also the people that didn't retire just to start taking care of their parents, but that's what ends up having what they have to do. So that's also why it's important for us to talk about, Social Security and delaying that, or what that might look like depending on what your situation is. And there's no, just like with my planning and your planning, there's no cookie cutter approach, right? It just depends on all the variables in your family situation.
That is so true. And yet, same as the areas you're in, for our areas, no one even knows the questions to ask, or even understanding that there's an implication. If I do something in Social Security, it absolutely affects Medicare. If I don't do something in Medicare, it absolutely affects my finances. So everything is interconnected in our very complicated healthcare world and financial world. And then you add the laws on top of all of it. And it's incredibly complicated.
Laws. They always get in the middle of everything, don't they?
Social Security laws, I know.
So tell me, they are all interrelated because one affects the other, right? So tell me, what most people, tell me about how Medicare and Social Security and how they all kind of connect and how they're kind of interrelated.
Yeah, it's a really good place to start, because I think one of the biggest surprises for most people is they don't understand, or even why would you know is maybe the better way. But why in the heck would you know that when you claim Social Security, thinking you need some income, your Medicare Part A comes attached, and you can never decouple Social Security with Medicare Part A. And when you go back and think about it for a second, it's like, well, why, right? So why? The why is because they're under the same law, and they were knitted together from the very beginning of time. So when we pay our FICA taxes, our employer pays them through payroll taxes, we think about it as we're paying into Social Security and we're paying into Medicare. Well, we're not. We're paying into the dancing duo of Social Security and HI, which is hospitalization insurance, which is Medicare Part A. So where the money goes in together, and therefore it comes out together. This is a happily married couple, going through the system.
Mm-hmm.
And Medicare gets triggered. So if you claim, say you need to now take care of a parent, so you've left your job, you need some income, you claim Social Security at age 64. Okay, so you take a reduced income from Social Security. Might not be your best decision, but now you've done that. So that's a lock in. Exactly right. That's an irrevocable decision. You've locked in lower payments than you were entitled to. But sometimes you have to do this.
Mm-hmm.
What you don't know is 2 months before your 65th birthday, you're going to get a big package in the mail from Medicare saying, welcome to Medicare. It's like, wait, I don't need Medicare. I'm covered on my husband's health insurance plan or my wife's health insurance plan. I don't need Medicare. Too bad, you're now in Medicare. Now that therefore blows up your health savings account if you were saving for retirement using an HSA at work with your health plan at work. So this interconnectivity just carries through in ways that we would just have no way of knowing these things are connected. So that's the story behind Medicare and Social Security. They are connected in the law. They are connected in your own pocketbook and with your decisions.
Every single time I tell you this every single time because it's true. Every single time I talk to you, I learn even more.
Oh, good.
So, but it takes repeated conversations. It does.
Yes,
because
this is not a once, you learn it once, right?
No. And then the laws change, right? And so it's important to have an expert who can help you with this because it's mind-boggling, right?
It is. And Annalie, if I could just add one more thing, what people don't know either, once you have both Social Security, regardless when you claimed, even if you optimally claimed, once you have that turned on and Medicare, therefore turned on, and you have Part B, so you're out of the employer landscape and you're now just on Social Security and Medicare, the amount of money you thought was coming into your checking account to live on every month ain't what you're going to get, because Social Security will automatically deduct your Part B premium plus any of the means tested premiums. They're called IRMA. I call it meet Irma. She's not your friend. IRMA is income related monthly adjustment amounts. And this is for those who have higher income in retirement. They pay more for their Medicare Part B. So you can have this year $170 taken out from your retirement, from your Social Security payment every month. You could have twice that amount. You could have up to almost $600 just for Part B premiums. So in other words, your income is a whole lot lower than you thought it was going to be. And that is a shocker for people because they planned on a different number.
Well, and a lot of people are living just on Social Security, and it wasn't set up for that. That wasn't the intent. The intent was that you work and that you save and that you develop your own retirement funds. But a lot of people are living Social Security's, check to check.
Especially women. It's especially older women who are now alone. Maybe their husbands have died. If they had children, the children are far away, and that's all they have. That's it. It's $1,300 a month less Medicare, or $1,500 a month, or $2,000 a month minus Medicare premiums. It's meant to, Social Security is truly only and always has been a social safety net. It was just meant to just give you a little tiny foundation. To keep your head above water.
Not to fund your retirement, not to fund your cost of living.
Right.
As people would know it. So let's see. What should people think about as they get into their early 60s and how to make the best decisions for them?
Yeah, so you really want to start planning. For all of you listening out there, do not wait until 65. I literally got a call, Annalie, at the end of March from a very lovely woman who said to me, hey, Marcia, I hear you help people get ready for Medicare, explain the process. And I talk about it in terms of I educate, inform, and help navigate. So I'll help you navigate through this very ancient labyrinthian system called Medicare. I said, yes, ma'am, I do that. She goes, great. Can we set up a time? Absolutely. And the first question I always ask is, when is your birthday? Now, this is March 30th, she called. Her birthday, April 20th. She's turning 65 3 weeks later. And it's like, have you applied for any Medicare yet? No, that's why I'm calling you. Like it's something you do in an afternoon.
Right.
And it is not. It is not a DIY project. You're not going to Home Depot where I talk about it, building a gazebo that you can do in a weekend. I can't, my husband can. I can put in the request, but Medicare's not like that. Social Security is not like that. You need to lay out the bricks to build this path to make really good decisions. because fortunately getting into Medicare is actually not that hard when it comes right down to it, but timing is everything. And she was already in a gap situation where she was not going to have insurance for a full month. No one can afford to do that. That's too much risk to take on. Right. But at least getting in is not hard. It gets really hard when you're trying to then decide, how do you fill your share of the payments you're going to have throughout your retirement, Medigap or Medicare Advantage? And those take a lot of research and a lot of digging. So again, this is not an afternoon like, oh, let's have a chat. Let's have some coffee. We'll lay out my entire healthcare situation for the next 30 years. It just takes a while.
I think, as you know, because we've known each other for a while now, planning, because you just said it in your, a few minutes ago, anyone listening to this or watching it, you have to start planning. We cannot give you golden solutions when you come to us in crisis.
Handed on a silver platter.
You get what you get when you don't plan. And so you shouldn't expect the best possible outcomes when you choose to not plan.
Yes. And and I feel for everyone not in our industry, because I think about a car, right? I am terrible about cars. I pick a car or a van, a color, and then I push a button now instead of a key, right? And it goes, and I do know to put gas in it. Okay. And the car goes. I don't know how it was built. I don't know how the steel is created into a car. And I sure as heck don't know how an engine works, right? But I know how to drive. I had my driving lesson, like 1,000 years ago now. And we know how to drive. And that's, lots of us, we just get in the car and we go places. And then add that to your 40 years of work where your employer has made really good decisions for you on health insurance in particular. And they come down you have no idea what goes on in this sausage making, right? As the employee, what you know is in November, you get a word, get an email now that says, hey, time to re-enroll for next year's health insurance. Pick plan X or plan Y.
Yep.
And you look at it, you do eeny, meeny, miny, mo, and you pick a plan and you keep going. We have no reason to know that once we're getting into retirement, nothing that we've been doing for the last 40 or 45 years applies any longer. We are now completely, and I literally talk about it, and being shoved off a cliff into the great blue ocean below. And when I don't actually jump off a cliff, but I hear it takes several seconds. And, not only is your life flashing by you, but you have enough time in those 4, 5, 6 seconds to be going, what the heck have I done? Well, you don't want to be there. You don't want to be shoved off a cliff. So I have, like you, we're both planners anyway, right. Annalise. So this is more natural for us than it is for lots of people. But if we could at least get the word out when you should be doing things. So at age 50, for your 50th birthday, buy whatever present you want, have a party. The next day, you need to be setting up your retirement income plan, your plan for the next 50 years. This becomes your baseline. And if you just did that one thing, you would start to see line items like Medicare, Medigap, Part D, IRMA, and you'd be going, what the heck is this stuff? Right. But this is the time to ask. You need to ask at 50, and then you put it away. You do it again at 55, because now at 55, you're really thinking about quitting your job. Can I afford to quit my job? That gets even more tempting at 60. And Social Security's doors open, the gates open at 62. And everybody knows that. Every single human in America that I've talked to knows 62. And they're counting down the seconds, right, till that, having no idea that it's going to trigger all this stuff for their health side of retirement. So if we could just, the magic wand, right? If we could just get people, advisors, regular people everywhere to sit down the day they turn 50 and do that first retirement income plan. Quick stuff. You don't need, it's not about the numbers so much as it is about the decisions you're going to have to make. That would just start to lay out, because really we're only talking about a 10-year gap or 10-year runway to learn all this stuff and get it right. So you're not being shoved off the cliff when your job all of a sudden ends. We have a pandemic and you need to quit your job. Your dad falls and you now need to become a caregiver, or your husband dies and you're on your own. We need to be better engaged. And that's this era of consumer-driven healthcare and consumer-driven retirement just means we shoulder it all. And we need to get in the game. We need to be smarter, and we can help you.
And we need to find professionals that can help us with that, because there's too much of a learning curve for families. You can only Google so much, right? Google will only get you so far.
Only so far. Yes.
And then how far it gets you doesn't mean that it's actually correct and accurate for your particular situation. And Marcia and I know each other from some other opportunities, and you need to, not all financial advisors are up to speed on all of this, because their specialty is financial planning. And this is also this obviously is a huge part of financial planning. So you just need to make sure that the people that you are hiring or have been paying know, like, it helps to know what questions to ask. And if your advisor doesn't know these answers, then you need to seek someone who does know these answers. And that's what Marcia does. And that's why we do these podcasts, to help families know what questions do they need to be asking, and when do I need to start these planning conversations and looking at what my next 30, 40 years might look like. So one key takeaway so far is, if you're at that 50 mark, that's one thing to be aware of.
Yes.
What are some other questions or things that people should know so that they can make informed decisions?
I'm hot on a couple of topics this year, Annalee. I try to have a theme for the year. I didn't really have one this year, but I got on my soapbox, and I'm distraught over Medicare Advantage plan advertising and about prescription drugs. Those are my two hot buttons this year. And I could talk for hours, but I'm just going to instead give
Those
you.
are my hot buttons every year too, because it messes people up. Because little Ethel is like, oh, that looks like a good deal.
Exactly. Because I don't have to pay anything. Right. Because the TV commercial said it's free.
Yeah.
Or it costs nothing. So I want you to walk away from this podcast today understanding that you have to have insurance, health insurance in retirement. So you cannot skip this. So get your A and B, get that taken care of, and that first. Then when you're deciding between Medicare Advantage plans and Medigap plans, Medicare Advantage is or Part C plans are the ones that are advertised at no cost. No cost equals $7,550 this year. That is your quote, no cost plan. So you as the consumer need to just be a whole lot smarter about what you're hearing on these commercials, and don't be sucked in to something that sounds too good to be true, because it is too good to be true. But I will say the insurance companies do provide all this information. The ads are just supposed to get you interested in, Medicare Advantage plan 1 or 2 or 3 or 5, whichever companies. Your job as the consumer is to get online and really start digging to find out, I don't pay any premium each month to be in this plan. That's the free part, but I'm going to pay $25 every time I go to a doctor, $40 every time I go to a specialist, X% if I have certain testing, and so on and so forth, up to $7,550. So if I have a major health crisis, I'm in a massive accident, and I'm in a Medicare Advantage plan, I need to be able to have budgeted and have it in I call my little healthcare bucket over here.
Yeah.
But I've got $7,500 sitting there, so I can pay all my medical bills that year. And then for the next year, you have to be able to refill that bucket. If you've used it this year, you still need, the calendar starts over every year, and so do the costs.
Yep.
So we need to understand how this insurance works. Really what Medicare Advantage plans are, they are coverage for catastrophic situations. So you don't have to pay any more than $7,550 this year. You're not going to pay $100,000, but it ain't free. So and that's my big soapbox on Medicare Advantage plans. Read the fine print. So don't be sucked in just because the ad is clever.
The ads are clever, and shame on them.
Yes, because technically,
Shame on them.
technically they're not wrong.
Correct.
Right? It's just completely incomplete information. The tiny type. We have a big TV at home. My husband likes a big TV. There's no way we can read on this gigantic jumbotron the footnote. It's like a little whisper.
Yeah.
So you have to go online and do the research. And then I will say it is all there. It is hundreds of pages worth of stuff. And if you are unwilling to be a smart consumer about that, that's okay, so long as you then have someone who can do it for you and you have to pay for that service. So again, time or money. Time or money. Those are the only elements we've got to work with.
And the challenge, the problem is too, that when, especially during COVID and the pandemic and all these people, everybody was like stuck at home, and that's pretty much all they could do, right? Was watch TV.
Yes.
And so, when it was during open enrollment, and I can't tell you how many clients I have that have memory impairment that would see that they're sharp enough to know, oh, this is a cost savings. And so they literally, and they still know how to use their phone. They're not totally in mid-stage dementia yet, right? So they're like, oh, this looks like a good deal. And when you've lived through the depression and you're always looking at like cost savings, and people just don't want to spend money, right? And so I can't tell you how many times, because you can't just take their phone away either, right?
Right.
But I can't tell you how many times the family and I were on calls because it looks like dad changed his insurance again, because every time he'd see the commercial,
he would call
3,000 times a day. And those sales reps on the commercials, they'll take your money, they'll take your credit card.
Yes.
So.
It is sort of unconscionable at one level that this is what we are subjecting our senior most citizens to.
Yes.
And it's there's no good solution. I mean, I also see it the other side. I'm a businesswoman. I get that we have businesses to run and the insurance companies are businesses. But I think there has to be something much better.
Yes.
So I'm getting to be more of this consumer advocate. If you're going to tell me I have to own this, I have to make all my decisions and, et cetera. You've got to be much more transparent. Stop with only the one big benefit. Right. The other thing with these ads, Annalee, as they talk about, we cover dental and vision and hearing. No, they don't. They do not cover that. They do offer you a little bit of money toward hearing aids or toward eyeglasses, so long as you use their network of providers. And if you don't like any of the eyeglasses at that provider, too bad. That's where you get to go to that one place. Mm-hmm. So to me, it's highly incomplete. Yeah. And preying on older Americans who did not grow up in this level of complexity.
And their generation had much more honesty and integrity.
Yes. Yes. So it's unfortunate. So that's my big soapbox issue this year is that. And then the Part D plans, the cost of drugs and how much work you really have to do. And this is age 60. So now your next tip is at age 60, because now you've done a couple of baseline retirement income plans. Now I want you to learn how to use Medicare's Plan Finder tool. And it is a wealth of information. And what you see is the result of 4 powerful organizations in the United States: the drug manufacturers, the Medicare itself, the federal government, insurers, and pharmacies. Mm-hmm. And you see this interplay. You talk about being tightly knit together. There are negotiations. I had to find a politically nice word. There are negotiations that go on that we will never know about. And the end result is every single year, what the pharmacies charge for the drugs, the pharmacy chains, and what the manufacturers decide they're going to make and what the insurers decide they're going to sell and cover under the insurance is unknown to consumers. And yet we have to make the decision because it's going to cost us. And I have been hot on this. So I ran some numbers just to give you an idea of what I'm really talking about in numbers.
Yeah.
For the cheapest plan, and this is Jacksonville, Florida. These are 2 generic blood pressure medicines, just something almost every senior is on a blood pressure medicine or 2. This is the lowest premium and drug cost. You'd pay $7.70 per month for your premium. Well, that's not bad, right? Okay, $7.70. I got it. But if you get mail order or go to CVS in this particular case, these pharmacies are preferred in network. So you would pay a total for the year for your 2 blood pressure meds, $116. Okay, that's doable. But if you don't know to go to CVS and you go to Medtown Pharmacy instead, it'll cost you $434. But if you really always go to First Coast Cardiovascular, which has a pharmacy, you don't know they're an out-of-network pharmacy, and you're going to pay $601.
Wow.
For the exact 2 generic blood pressure meds that cost $1 a month, but only in a preferred pharmacy setting. This to me is about the most egregious thing I've ever seen for our oldest Americans.
Yeah.
Really? And they won't know. And I called my CVS when I was doing this. I was doing a large frame analysis in the fall during open enrollment season. And I called my CVS and I said, well, how would I know if you're a preferred in-network pharmacy? And God love her, she said to me, Annalee, you won't know because we don't know.
Oh my gosh.
The actual people in the pharmacy have no idea what the home office is doing. They don't know how they're categorized based on every insurer. There's no transparency. There's no chart on the wall. There's no way for a consumer to know this. So that's why I say at age 60, you get on Medicare.gov and you put in your prescription drugs. And if you don't take any drugs, that's fine. Pick 3 of something that somebody else takes and start to get under the hood, start to see how the engine is built. It is too darn important to skip. So that's what I'm hot on this year.
Oh, and rightfully so. You know, it's because I don't think people realize when they retire how their life is, you know, they're so like, yay, I can finally sleep in or whatever.
Yes.
But they don't realize that's what I'm excited about. But, but they don't. They're like, oh, I don't have to set my alarm clock ever again.
Ever again.
All of my doctor's appointments will be scheduled in the afternoon because this girl doesn't get up early. So I've gotten up early my entire life and I'll be done. So what they don't understand is just the cost, like how expensive retirement or health changes is. And in my line of work, families are blindsided all of the time because when I'm educating them so they can make informed decisions about cost of care and, oh, dad needs a scooter and, oh, we need this or we need that, or, oh, you need a ramp. People think Medicare pays for everything and it simply does not.
It does not.
The retirement bucket. You know how financial planners talk about all your buckets?
Yes.
Yeah, Medicare is not your retirement bucket. It's an insurance. So you only get it. It'll only pay for what you need that it deems that you think you need it, right?
Yes. There's a lot of decision making that you don't know about. Then what will be covered and what won't be covered.
That's right.
And it changes. This is the thing. It's not, I was working with a couple just yesterday and they said they kind of did this, you know, put their hands on their head and they said, wait a minute, you're let me make sure I get this right. You want us to make a decision now that we have to stick with for the next 30 years.
You're like, yes, I do.
Absolutely what I'm telling you. I said, no, the law could change. Anything could change any year. But with the information we have available to us today, that's exactly what I'm telling you. The decision you make today impacts you for the next 30.
Right. Because you can't just, because they're so married together, the Medicare and Social Security, you can't be like, you know, start claiming at 62 because that's what you wanted to do. And then realize, oh, if I would have delayed Social Security, I could have made, you know, X amount of dollars more per month or received X amount of dollars more per month. I mean, you're locked in. So
are locked in.
you've got to make wise decisions now, and
Yes.
you have to be an informed consumer. And it's unfortunate that that's what it is, but that's what it is.
Yes.
And so
That
if
is
you
what it
want
is.
to,
With no education, it's not like we start in kindergarten and learn about money and finances and financial literacy, as we talk about it in our world, FinLit,
Yep.
financial literacy. So you are literally on your own, back to the being shoved off a cliff. And you got to figure, in the 7 seconds it takes to hit the water, you've got to figure all this out.
Yep.
And that is I grant you, it is an unrealistic expectation to be foisted onto the American consumer, but that's where we're at in this country.
Yep. And we're both on the same parallel with consumer advocacy, with, patient family advocacy, because, well, everyone needs someone to take them by the hand and help them understand all of this, or at least point them where they need to go so that they can make informed decisions, because these decisions can be permanent. Even when families come to me, families, they don't want to spend money, right? And so they'll do what they can, and they don't know what they don't know. And so then when they finally realize that their back is up against a wall and they made some really big decisions and they weren't maybe the most wise decisions, now they're having to pay me even more to try to undo what they thought that they knew.
Yes.
And if you were to just do it right the first time, hire the professionals and just do it right the first time, it will save you so much angst and money and time and overwhelm and sleepless nights if you just do it right the first time.
Yes.
How do you shop for Part D plans? And in the last 5-6 minutes of the podcast, how do you shop for Part D plans? There's lots of hidden information.
Yes.
Actually, I think you might have covered some of that a little bit.
Yes, but it is worth mentioning again. It is really the level of research that you need to do for people who just have, the 2 generic drugs. It shouldn't be that much, right? You're thinking, I have 2 generic drugs. And again, you've always had coverage from your employer or your spouse or partner's employer plan. You've had this coverage, but you now have to make the decisions about that coverage. So the good news is information is available to you. The bad news is you have to spend a lot of time digging it up, digging for it and figuring out what it means. Starting early is super important as well. So again, 60, but then let me add a couple of options for you as well. The local senior centers or councils on aging available in virtually every county in America. They have usually team up with a group called SHIP, SHIP as in Peter, not T as in the bad word. So the SHIP representatives are very well schooled in the Medicare decisions that get made in the plans that are available to you in your zip code or in your mom's zip code. If you're, a different state, and, if my mother lived in Arizona, I could talk to the Arizona SHIP representatives to help navigate the local landscape. And they're very, very good at that. They also can help if mom or dad has run out of money, run out of assets and so forth. They can help you with the special programs available in the state where the person who's run out of money lives. So everything is done at the local level, literally zip code and county. So the SHIP organization is a volunteer organization, but it's part of Medicare, the law that says everyone has to have, at no cost, access to people who can help them navigate the local landscape.
I think that's obviously very helpful, but I was also thinking about something that families don't always think about, because when there's a medical crisis and everything is happening at once and you're overwhelmed and you're not sleeping and you're not thinking straight because you're like, oh my gosh, is this the new normal for my parents and my family? And how are we going to make all this work? And one of the things I see families, and when they come to me, that's part of that 20-point component of an aging plan, because checklists make people successful because it's simple.
Yes, they do.
And so, and it's easy for people who are already overwhelmed to, we kind of just follow, it's a process that I created and it works. And that's why those families are better off. And so What families don't think about though is when they've had, like after dad's had a major stroke or something like that, and his medication list is now like, super long, and he's on all these other meds. Families don't think about, oh, would this trigger an event where I can, look at a different Medicare Part D program? Or, so there's that. And then on the flip side, say Ethel and Marvin live in Tucson, their kids live up all in New York or whatever, and they're like, Mom and Dad, let's move up, move up to us, because we need to be able to advocate for you, because we know what the care is like in most of these care communities. We can't just keep flying, across the country to come to you every time there's a problem. And so what I think a lot of consumers don't always think about is when there's been a major change in health or a medication list or a relocation, which care communities, if we're looking at like nursing homes, for example, which nursing homes contract with which insurance carriers, right?
Yes.
Because I have a lot of clients that one of the reasons the hospitals were backed up during COVID is because these skilled rehab units don't contract with all of the different insurance carriers, right? If you have straight Medicare, you can get into anywhere. But when you had the Humanas or the Aetnas, people were staying in the hospital for days and weeks extra because they had to wait for an open bed and get insurance authorization into that skilled rehab unit. And families don't know all that. They're like, but what you don't understand is every day that you're in a hospital bed and you're not moving around, it's going to take you that much longer in rehab. And some people they can't afford to lose ground any more than they already were. Right. And so that's one of the reasons the hospitals got backed up, and people don't talk about that, but that's really one of the things that happened. And so it's really important to know, okay, and that's what we talk about in an aging plan is, okay, if you relocate to daughter Sally in Rochester, what do we need to be thinking about for if she needs to go into a nursing home or a skilled, into a rehab or anything like that?
Yes.
What facilities contract with that particular insurance?
And that's particularly important if your older person who's on Medicare has Medicare Advantage plans.
Yes.
Because the way the Advantage plans work and why you can get, $0 per month premiums, they're in a network. It's a local network. So the first problem, right, moving from Texas to Rochester, you no longer can even have that Medicare Advantage plan. That's going to go away because you have a valid reason to change. But let's say you were on a Humana plan. Then you go to Rochester and find out Humana isn't even an operator in Rochester. Yeah. I don't know if it is or isn't, but that's for an example. And now you have to deal with Blue Cross operation insurer, or I don't know who else is in Rochester. I don't know, say it's Kaiser or it's Mutual of Omaha, insurance companies you're not even familiar with, which isn't a bad thing, except we're back to square one of doing all the research.
Right.
And then you have to marry up. Does the plan now that mom or dad likes, does it work with the rehab, the skilled nursing facility? And do they even accept it? And I'll use Blue Cross because everyone seems to know that insurer. It's not that the facility takes Blue Cross. They take Blue Cross. It's whether they take Medicare Advantage plan 45678-7 that mom picked. Do they take that exact Medicare Advantage plan? Yep. Oh, no, they don't.
Yep.
So it's not the insurer, it's the actual plan. And that's because of all this pricing negotiations and all these adjustments and all these deals that got made that we as consumers have no idea how these numbers show up on our bills and such. So it's very challenging, especially in a crisis. I don't know how anyone would do this, Annalee, in a crisis. It's hard enough to do it when you're 60 and you're just thinking about the what ifs.
Well, that's why they end up making very expensive mistakes. So hopefully this podcast wakes people up and say, oh, this is a lot more complicated than I thought. Or, oh, Google, I can't just simply Google this, or I can't ask neighbor John because he just went through all of this. Neighbor John's situation is probably very different than your situation. So, teaming up with professionals and working with professionals is the way to have the most successful, positive outcomes. You have written a book. Tell me about that book quick.
Yes. Thank you. 2 books actually, but in the same series. So I write a lot about women because women tend to not even be as financially confident as they really are. So what's the deal with retirement planning for women? And then what's the deal with Social Security for women? And I also write a blog every month and a lot of articles in Retirement Daily. So my blog is boomerretirementbriefs.com. And there's just lots of great information out there for boomers because we're the ones in the thick of things right now. So enjoy. Feel free to hop on to boomerretirementbriefs.com.
That's cool. And when we get this video, when we get it sent out into our database and so forth, and we'll send you the link as well. It'll have your contact information and your references that you sent along too, with the articles that you wrote and things like that. So like, we're so fortunate to have you, and thank you for carving out time in your busy day to help families understand that this isn't as easy as 1, 2, 3. Like
it's really not.
It's not as easy as 1, 2, 3. There's a lot that needs to go into this. You have to think about a lot of different things, and that's what this Caregiver Crisis podcast does, is help families know that there's resources out there to help them. So
yes. Thank you for inviting me, Annalee. It's always a pleasure to talk with you.
We should have just hit the record button as soon as we started talking today, because I think even all of the stuff that we were talking about then would have been helpful for the people too.
Yeah, exactly. Little snippets of, yeah.
Hey, everybody, you just grab a cup of coffee and just listen to Marcia and I talk.
Yeah. That'd be great.
So,
well, thank you.
Thank you so much, Marcia. You have a great rest of your day, okay?
Thanks, Annalee. You too. Bye.
Bye.
Thank you for tuning in to the Care Right podcast. We hope today's discussion has provided you with valuable insights. If so, don't forget to like, subscribe, and share our podcast with others who might find it helpful. Remember, Care Right is more than just a podcast. It's a community dedicated to supporting family caregivers with comprehensive care planning, crisis management, and resources for every stage of aging. Stay connected with us for future episodes as we continue to explore essential topics in aging planning, elder care, and financial planning. Until next time, take care, plan wisely, and remember, you're not alone in your caregiving journey.